Hey everyone, it's Kristen. Today we're going to talk a little bit about scrubbing the hub and sequential access. The reason why it's important, it's a couple different reasons. First is these caps. So these caps are really meant to help to protect our patients from getting an infection, helps to keep things from coming in. There's also some antimicrobial stuff in there to help kill some of the infections. So when you have this cap screwed on appropriately, and it's been on for at least a minute, it should kind of help, and you shouldn't have to do a lot of that manual scrubbing unless there's stuff that's soiled on the outside of it. However, the manufacturer has noted that some of these caps have been popping off erroneously, or they've been not fitting on great. And so they're looking into it, but it just means that we need to make sure that we're thinking about that when we're taking this off. Does it hurt if you don't know if it's been on for at least a minute, or if you are just wanting to be extra safe to scrub after you take that off? Doesn't hurt at all. Does not hurt at all. Still want to make sure we're putting those caps on there because, again, it is an extra form of protection for those IVs, especially our central lines. It's required for central lines. It's great for PIVs if they have a central line, or even if they don't have a central line. It is great for it, but we definitely want to make sure that we are scrubbing the hub. So in this case, we'll pretend that this has been on for a whole minute, and we have some meds, low budget here, that we need to give through this IV. And so we would remove this. Of course, we'd have on gloves, all the things. We'd have on our gloves, and we would hook this up using that aseptic no-touch technique. So we're not touching the end of the IV with our fingers, even if they're gloved, trying to do that aseptic no-touch technique. And then we're giving our medication. After we've given our medication, we realize, crap, we need to give another medication, or we need, even if we just need a flush. When you take this medication off, you need to scrub. It's called sequential access. And a lot of us, self-included, sometimes forget, or sometimes are just, we're talking, we get distracted, but it's important to note that every time that we are accessing this catheter, we need to make sure we're scrubbing the hub. How long do you need to scrub? You need to scrub it with alcohol for at least 15 seconds. 15 seconds is going to feel like a long time. So you want to make sure you're getting all in there and scrubbing it. That's policy, and that's also what the CDC and everyone else is recommending, to make sure that we are not introducing any new skin flora or anything into that line. So we're scrubbing, and we're scrubbing, and we're scrubbing, and we're scrubbing. So we're making sure we're getting in there. Next thing to do before you give your next med, or before you give your flush, you gotta let it dry. Because if you're not letting it dry, it doesn't really matter. You just put a bunch of wet alcohol in there and you're not letting it dry. That dry time is just as important. You can hear it called things like a kill time, because it is killing and working during that time. All right, so it's been plenty of time. So now what we're gonna do is we are going to go ahead and hook up our next syringe to go ahead and flush. Gonna give our flush, and then we're going to go ahead and clamp and discontinue our medication. It's important to use a new Kuros cap every time. So again, that way we're protecting the IV line, but also so we are getting a new kind of dose, for lack of a better word, of that antimicrobial stuff, the disinfectant that is going on inside of this cap. Again, if the cap's on for a whole minute, it's good to go. You don't necessarily need to scrub the hub, but just word to the warning that these caps right now, there's that manufacturer guidance saying that you gotta double check these because they are coming off really easy. So we want to make sure that we are doing all we can to prevent our patients from getting line infections, or also from getting bloodstream infections, because bloodstream infections in a transplant patient are very bad. So sequential access, really important, making sure you're scrubbing in between medications, in between flushing. That's what sequential access is all about. So when you hear that, now you know exactly what they're talking about. All right, thanks.